I'd now like to invite our first presenter, Dr. Douglas, to speak.
Thank you very much, and I hope everyone can hear me fine. It's really my pleasure to present today the effect of Teprotumumab on proptosis reduction across various demographic subgroups. And I do this on behalf of the authors, Dr. Cahaley, Dr. Smith, Robert Holt, and Sabasili. And so, next slide, please. I have a financial disclosure that I am a consultant for both Horizon Therapeutics and Immunovant Incorporated. Next slide. So thyroid eye disease is associated with autoimmune thyroid disease, predominantly Graves' disease, and it's characterized by inflammation and proptosis with a significantly altered appearance and vision changes that you're going to see in some slides later on. It's caused by an autoimmune overactivation of the thyroid stimulating hormone receptor and insulin-like growth factor 1 receptor complex, and this is on orbital fibroblasts. This complex and activation of this complex triggers a cascade of inflammatory signaling, which includes release of pro-inflammatory cytokines, but also the overexpression of glycosaminoglycans, such as hyaluronan, and proliferation of the fibroblasts and fat and muscle expansion behind the eye, which causes the characteristic physical changes that you will see. Next slide. Teprotumumab is a fully human monoclonal antibody that binds specifically to the insulin-like growth factor 1 receptor, and it's an inhibitory molecule. It binds to the IGF-1R TSHR signaling complex, causing internalization and blocking of this signaling complex receptor. It halts the signaling of this complex at the source, where there's overexpression of the IGF-1 receptor, namely the orbital tissue. And it causes reversal of the orbital tissue expansion and the hyaluronan production characteristic for this disease. And it's the first medication now indicated for the treatment of thyroid eye disease. Next slide, please. This is a summary of two trials, phase 2 study and phase 3, that were very similar or close to identical in their design. They were both two 24-week randomized, double-masked, placebo-controlled trials testing Teprotumumab versus placebo. You can see that 88 underwent randomization in phase 2 and 83 in phase 3. And eventually, and what I'm going to show is the combination of this data, the combined data over these two trials amongst many centers. Overall, 76 patients completed the double masked treatment period with Teprotumumab compared to 79 completing the placebo period. Next slide. This is a very important slide because it shows the crux of how effective this drug was in treating this disease. Proptosis is when the eye bulges, and it's the characteristic finding of thyroid eye disease. It's the cause of the facial disfigurement and even the blindness that's associated with this disease sometimes. A reduction of 2 millimeters or more in proptosis is considered a very clinically meaningful result and has never been seen with other drugs in the past. This was the responder rate as far as the percentage of patients who achieved at least a 2 millimeter reduction in proptosis. And this drug is given every 3 weeks. And you can see at 0.6 weeks, approximately 55% of patients already had a response to Teprotumumab. This was the minimal criteria for response. You'll see that proptosis was actually reduced further, but this then went on to reach nearly 80% of the intent to treat population at week 24 receiving a response. And significantly, the number to treat of patients was 1.6 with this treatment. Next slide. What I'm going to show you is a subgroup analysis looking at both smoking, US versus European centers, age, male and female dominance. And what you can see in the center portion of the slide is the treatment difference from placebo for proptosis responders, meaning the percentage of people who responded to the drug versus placebo. And the further you are to the right is the more that they responded to Teprotumumab compared to placebo. And you can see overall the responder rate is just as we discussed in the high 70s. Next slide. But you can also see that smokers versus non-smokers had a similar, though tobacco users had a much broader range of improvement, but both groups benefited from this drug. Next slide. You can also see that both the European centers and the US centers, which were roughly equal, both these patients benefited from the drug quite significantly. And even older patients versus younger patients, who sometimes have slightly different characteristics of disease, both benefited likewise from the disease. And so did male and female patients. Notably, this occurs more in female patients, but male patients are often more severely affected. Overall, demonstrating that this really provided improvements in proptosis across all subgroups. Next slide, please. Most importantly now is not only did we meet the minimum criteria with teprotumumab improving proptosis, but the proptosis reduction continued to improve. You can see from week 6 to week 24 reaching a maximum of about a reduction of 3.1 millimeters. Now, just as a comparison, I'm an orbital surgeon, and that's about what I would achieve by doing an orbital decompression or removing the bone behind the eye, the bone that separates the eye from the brain. So you can see that this is a very significant improvement with a medical therapy. Next slide. And this really highlights the effect that patients see in the mirror, and you can really only surmise the beginning of what they experience in this improvement of their quality of life, which was also demonstrated in these studies. In the above clinical photographs, you can see baseline versus 24 weeks of placebo. Not much changes in this disease without definitive medical therapy. In the lower set of clinical slides, you can see patient treated with teprotumumab. At baseline, this patient was beginning to have the earliest signs of losing vision, and it was really at a potential risk for losing vision due to this disease. You can see below, after 24 weeks, what the significant improvement was of medical therapy. This has really been unheralded in comparison to other medical therapies previously offered. Next slide. Overall, teprotumumab provided an improvement in proptosis. We saw proptosis responder, but it's really paralleled here in this slide, just for clarity and completeness, demonstrating, next slide, that tobacco users and non-users had almost a 3 millimeter reduction in both teprotumumab treatments. And in addition, next slide, both the European centers, older versus younger patients, male versus female patients, all had a very significant and similar reduction of approximately 3 millimeters or more in some of these subgroups, demonstrating that really there doesn't appear to be a particular population where teprotumumab doesn't improve the proptosis, but it seems to be improvement across all subgroups. Next slide. The safety is really important in this medication because we want to make sure that it's a safe and effective medication. The treatment adverse events are seen, and serious adverse events were higher in teprotumumab. 2 were considered related to treatment: a diarrhea and infusion-related reaction leading to discontinuation of the study, and Hashimoto's encephalopathy, possibly related to the study drug, leading to interruption. The one patient in the placebo had progression to optic neuropathy and vision loss and had to be removed from the study. There were an occasional report of an anti-drug antibody, but really just in 2 patients, one at study day 1 and another at week 3 during the 24-week assessment period. The day 1 patient was also positive at 72 weeks, but this appeared to be relatively very uncommon. Next slide. The treatment emergent adverse events occurring more than 5% of the patients are shown here. The muscle spasms were relatively well tolerated, usually occurring at night, and simple massage. There were no electrolyte abnormalities. The nausea, diarrhea, fatigue were associated usually immediately after the infusion for a couple of days and were well tolerated. Of note, the hearing impairment was more of a plugging of the ears in my assessment and evaluating these patients, and almost all of these patients improved, and this was, and all of these effects were improved after the discontinuation of the drug. And they were all considered mild to moderate in intensity. Next slide. So in conclusion, these two placebo-controlled studies really show that Teprotumumab reduces proptosis, also double vision in the clinical symptoms of inflammation in patients with active TED, which it did not show, but while proving that it's really clinically meaningful improvement in their quality of life, as you can certainly see from the photos. And the Teprotumumab reduces proptosis regardless of their baseline characteristics of age, gender, or smoking status. And this drug was approved by the FDA for the treatment of thyroid eye disease in January of 2020. And again, thank you, and thank you to my co-authors for allowing me to present this for you here today.